for a second. I'm actually out of power at my house this evening. It's kind of getting dark. So hang on with me. I'm just gonna make sure we are on here. It looks like we are. Yes, awesome. Thanks so much for joining me tonight on this day of not having power at my house. My name is Julie Hirschberg. I am a neurologic physical therapist. I am the owner and founder of Reactive Therapy and Wellness. We're in the Los Angeles area, and I just get to come here and share with you all what we are learning, what we're doing, what we're reading, and yeah, just learn alongside of you all. And one of the recent articles that was shared with me, I just loved. It was so simple, so straightforward, provided a lot of great information for hypermobility. And this is something that we see a lot. We have an EDS program at Reactive that is PT, psychology, yoga therapy for people with Ehlers-Danlos syndrome, or EDS. And our amazing OT leads that program. But we see it comorbid in a lot of other conditions. It's something we see a lot. It's something I wasn't really, okay, coming back. I think this is related to power at my house. So we're going on cellular. Bear with me. Let me know if the sound's not coming through, but it looked like it paused there for a moment. But I was talking about hypermobility and how much we see this as a comorbid condition with other neurologic disorders. And so this is really important for us to understand as clinicians. And this is not something I always understood. So part of our mission is to grow the base of therapists that know and understand some of these misunderstood, or, they're not rare. Hypermobility disorders are not rare, but they're not well understood by all healthcare providers. And I loved this article. Let me go ahead and share a shot of it. I'll put it in our newsletter this week. But here is the article. It's a continuing education article in topics in pain management. It's from just last month, so it's very up to date. And this was part 2. It's Hope for Hypermobility, an integrative approach for treating symptomatic joint hypermobility. The authors, Victoria Daylor, Courtney Gensimer, Russell Norris, and then Linda Bluestein, really well-known physician in the hypermobility world too. It's somebody that I follow and learn a lot from. All of these folks are from most of them, Department of Regenerative Medicine and Cell Biology and the Department of Neurosurgery at University of South Carolina. But also Dr. Bluestein is in Wisconsin. So anyway, wanted to give a shout out to all the folks that put together this really great summary article. It doesn't go into a lot of depth, but I think it gives a really great summary. So if you're new to hypermobility, you're still learning, you're wanting to understand some of the basics, I think this is really helpful. And they give this approach, which I think is really helpful to think of. So let me just bring up that image too. This is directly from the article. And it is a little mnemonic of things from an integrative health standpoint that are helpful in hypermobility, particularly symptomatic. They use that word, symptomatic joint hypermobility, and particularly related to pain. Most of the folks that we work with, most of the world with hypermobility disorders will experience pain of some sort. So this is the MENS PMMS. It's a lot of letters. Treatment strategy, but it's movement, it's education, it's nutrition, sleep, psychosocial, modalities, medication, and supplements. So what I think is really nice about this article, and again, I'll put a link to it in our newsletter this week. If you're not on our newsletter and you're a clinician, join us at reactiveeducation.com. If you're a patient, join us at reactivept.com. I'll send out all the links to this. If you have hypermobility, I would literally hand this article to your clinicians if they're not familiar with it, because of the breadth of pieces that it goes through with this little mnemonic, starting with movement. Now, I'm a physical therapist, so I'm of course kind of excited that they started with movement. And because a lot of people with hypermobility experience pain, they experience fatigue, they experience injuries and dislocations with movement becomes problematic. And there can be a lot of fear associated with movement. There should be, because the person is being frequently having injuries. And so this can lead to less movement, which is not necessarily helpful in the human body, but in hypermobility disorders, definitely. And so they start with the movement and they review some of the literature. Thank you. For the effectiveness of exercise and physical therapy in EDS and in these joint hypermobility, particularly in improving physical as well as quality of life and psychosocial outcomes. So I think this is really important. Physical therapists can have a huge role in hypermobility. Some of the things that we see, and they mention in here, and this is why, there's not a PT on this article, but I kind of feel like they've been talking to PT because they bring up some of the biggest pieces that we see, like, joint dislocations, obviously, instability, dizziness, poor proprioception, exercise intolerance, all of these pieces that really do require a unique approach of physical therapy. Your traditional pieces don't always apply. I just saw Ariel that joined. Ariel, I've been thinking of you a lot as I've been looking at the literature in this, and some of the things that, and they even bring this up in this article, Pilates can be so helpful for improving joint stability, proprioception, strength around joints. And I mention that because Ariel is one of our physical therapists who does a lot of Pilates and wants to bring this to this population as well, which I think is phenomenal. Also yoga. So I think a lot of folks in the world love doing yoga. A lot of people with joint hypermobility have sustained injuries doing yoga. And this is where I think a modified and accessible yoga can be really helpful. We work with a yoga therapist, and part of a yoga therapist's background is to really understand the pieces that might need to be modified in different conditions. And we're so lucky that our yoga therapist works alongside of us every single week in all of our programs, including a lot of people with joint hypermobility. And I think it's really important to understand that your patients with hypermobility, or if you're a person with hypermobility, it doesn't mean that yoga's out of the question. It just means that you may need to modify for yourself. And having a really experienced yoga therapist, I think, makes a world of difference. But they talk about yoga as a form of a treatment strategy from a movement perspective. So that's the M at the top. The E is education. And they talk about the literature, particularly in pain neuroscience and education, and how helpful that can be. Another thing they talk about, I'm so thankful for, is they talk about mast cell activation syndrome or disorder, MCAS or MCAD. And this is something that we see frequently as a comorbid condition in EDS. And so education around identifying mast cell triggers in a person, and how they impact the symptoms is really important. And so again, I love this article because I feel like this is what I would bring to my doctor, because it talks about these things. It's also very short. It talks about each of these things that are quite honestly not well understood and well known, including mast cell activation and how common that is in hypermobility disorders and what to look out for. So again, thank you to these authors for bringing those pieces in. The next part of this mnemonic is nutrition. And so I'm not a nutrition expert. Some folks on our team are, but they talk through some of the literature of some of the different pieces of nutrition that can be really helpful. They talk about anti-inflammatory foods to incorporate into a diet for a person with hypermobility disorder, and to ensure that a person is also tested for nutritional deficiencies. And this is something too that I think is important, is, you know, really having that full blood work. I mean, I know I do, and it's like I might have to take vitamins and supplements to help in areas where I'm deficient. So the same is true in hypermobility disorders. So really nice section on nutrition in this article. The next, though, sleep. One of my favorites, not just because I love sleep, because I do. I'm one of those people that needs like 8 hours of sleep every night. I love, love, love my sleep. But they talk about this bi-directional role of sleep as both a cause and an effect of pain, right? So most folks that we see who do have hypermobility and pain, it makes it difficult to sleep. No surprise there. The lack of sleep also contributes to pain and dysfunction. And they talk about cognitive behavioral therapy for insomnia. And this is a treatment technique that all of our occupational therapists actually have been trained in. And they talk about some of the evidence in this and in improving sleep, particularly if sleep is related to insomnia. It's not for all people, but I have certainly found working alongside our occupational therapists and understanding this has been so helpful. We do know that sleep apnea is a known comorbidity of hypermobility dysfunction, particularly EDS, and this can be a source of fatigue. And fatigue is one of the biggest factors related to a lot of different disorders, neurologic disorders, but definitely in the hypermobility syndromes. And it's so disabling. And so this is where sleep intervention, and again, they use this integrative approach because this is really such a specialty of occupational therapy. I think it can just make such a big impact. So that was the S. So we did movement, education, nutrition, sleep, psychosocial. So I think this is also really important. Most folks that we work with hypermobility syndromes, unfortunately, have been through a lot of medical appointments, a lot of medical mistrust. Maybe they've been told it's all in their head. Maybe they've been told there's nothing wrong with them because they haven't seen providers that understand these syndromes. And that's really traumatic. Another thing that the authors talk about, which I think is so important and so under-recognized, is the comorbid conditions of having neurodivergence along with hypermobility disorders. They report on a study where